Hello, my name is Jan Trewartha and I'm the director of the Fascia Hub and the British Fascia Symposium. And I'm delighted to welcome today our lovely Carol Davis, who is not only one of our favourite presenters for the Fascia Hub, but she's agreed to be one of our 3 keynote speakers for the British Fascia Symposium, which is in May this year, the 20th to the 22nd. It's an online event, but we're bringing in as much human engagement and possibilities of you talking to your fascia heroes and our experts. So today is one of a series where we introduce different people who are going to be presenting at the British Fascia Symposium. And Carol, I'd like to welcome you. Thank you.
Thank you, Jan. Nice to be here. And I'm really looking forward to the symposium this year.
Me too, me too. One of these days we'll do something in person, but for the moment we're online, and so many people appreciate it being online because they would have found it impossible just to come to the UK for a weekend. Right. So there's it swings and roundabouts, isn't it? There's good things and difficult things, but the Fascia Symposium is going to be brilliant. I know we've got 3 days, each led by a different keynote. We have you on Friday, and then we have Gerald Pollock on the Saturday, and then Robert Schleip on the Sunday. And what I'd like to ask you first, Carol, you're going to do 2 things. One is our keynote lecture, and one is an informal hosted conversation. Now, we always ask people to talk about something at the BFS that gives them, that excites them, that they're passionate about. And so I'd like you to, if you would, tell us the title, and then briefly talk about your lecture and what you want to get over to people and why it excites you, this topic.
Okay, I will, Jan, thanks. And I'm just so looking forward to working this out. Of course, I haven't put it all together yet, but it pulls together 2 areas, well, really 3 areas of interest, of scholarly interest that I've had for, since the 1970s, really. And the title of my presentation is Human Beings Are Dynamic Process, Fascia, Consciousness, and Empathy and Healing. I did a dissertation in the 1980s on empathy as an interpersonal process in patient care. And since I've been studying fascia and fascia integrity, especially in biotensegrity and fascia, Joanne Avison and John Sharkey have coined the term fascia integrity, which really suits my purposes because I can't talk about fascia in a meaningful way without talking about the dynamic motion, the push-pull, compression and tension of biotensegrity as the foundation of all of what's happening within fascia. And so basically what I wanted to bring together here, and let me read what I put down for my description. Fascia integrity supports a constant dynamic flow of information within us throughout the liquid crystal matrix, fascial matrix, the liquid crystal fascial matrix. James Oshman talks about it this way, that fascia is a liquid crystal matrix. And conscious awareness is made possible by way of interoception from nerves embedded within the fascia of the body and the brain. A specific form of attention to consciousness of interpersonal interaction facilitates the experience of empathy as a crossing over of awareness between people, paving the way for the possibility of a unique form of inner knowing of the other, as described by the phenomenologist Edith Stein, a German phenomenologist. You hear Jaap van der Wel often talking about the experiencing of biotensegrity and the living body, the lived body versus the studied body. We're going to be talking about the lived interaction between the therapist and the patient or the client. A resonance similar to this in manual therapists with our patients has been shown to calm the interoceptive nervous system, the nervous system that has to do with feelings, perhaps facilitating a lowering of sympathetic tone and assisting intracellular vibrational balance and ease, or a balance coming back into a kind of a better efficiency in the fascia when the therapist and the patient are aligned with one another. Now, this gets into the nebulous part of fascia integrity that's difficult to measure. And it gets into a kind of a territory that's scary for people to talk about, because some people think, well, that's a little bit too much mystery. What I want to do in my talk is to provide a structure of thinking about this material based on empirical science, so that we can say that of what we know about the interoceptive tracts, for example, and the insula and the interoceptive system, along with the proprioceptive system, and what's happening between the therapist and the client or the patient, that there's some sort of knowing that changes that we haven't been able to really pin down how that happens. And I just want to explore this through phenomenology, through neurophysiology, and through an understanding of fascia integrity in this talk.
That sounds really exciting. And I know you're a speaker on the 12th of March for our Fascia and Resonance event. Yes. So this is there's going to be a follow-on, really, from the Fascia and Resonance event, I think.
It is. Yeah, because this was really talking about resonance.
Yeah. I think that's going to be very exciting, Carol. Thank you. Yeah. So our informal hosted conversation that you're going to
it also builds on this, Jan.
Also builds on
this is what excites me. This is what I'm interested in talking about.
Yeah, this is so exciting.
Other people.
Yeah, I think, as therapists, we often have experiences and we think, oh, how do we explain that? Is that all woo-woo and mystical? Well, it's not, no. And it can be explained by science. And I'm delighted that you're going into this. Thank you. And then the hosted conversations that we're running, these are much more informal and really Carol and the other people who are running one, Robert Schleip is running one, can just go to that meeting room. And the person will be talking about something, again, that excites them, raising a topic and inviting people to come and join in, to discuss, to air their views, so that you get real engagement. So can you tell us what your topic is for the hosted conversation, please?
Yeah, the topic of the hosted conversation builds on my fascia, my speech for the British Fascia Symposium, the keynote lecture, is going to be then the talk, the chat room discussion is going to build on that, and the basis for that is an article that's found in neuroscience, and it's called "The Effect of Continuous Touch on Brain Functional Connectivity is Modified by the Operator's Tactile Intention," and I'll probably introduce that in the symposium, or I'm sorry, in the speech, the keynote speech. But then we'll be talking about our experiences with patients and how what we've experienced translates, and the science that's in the published article, what the science says about it, and how we can then talk about that in relation to what we've experienced both as movement therapists and as manual therapists. And perhaps there'll be some psychologists that will join us, and nurses and physicians, other people who are intimately involved in the interaction and the effect of the interaction on the nervous system, especially the autonomic nervous system, of calming people down and allowing them to become more at ease and with less pain. That's what we're really trying to do so often. We're trying to diminish the negative effects of fascial restrictions on the nervous system, on pain, and the tangling up of scars, and the feeling of sixes and sevens that we just can't get centered over ourselves, fascia integrity wise. And so that's what we'll be talking about.
It sounds so exciting. I can't wait, Carol. I'm going to be attending. Obviously, good. I'm going to be at your hosted conversation. Definitely.
Wonderful. Yeah. Welcome.
Thank you so much for coming and talking to us about this.
My
and
great
I know people are going to be excited, and we look forward to it. We'll see you soon.
Well, thanks for inviting me, Jan. It's a great pleasure.
Take care. Thank you.
You too. Bye-bye.